Cosmetic dermatology, Botox or Dysport injections. Botox and Dysport are two of the most well-known, popular, and effective anti-aging treatments. These neuromodulators are a type of injectable prescription medication that temporarily freezes small targeted muscles. Both Botox and Dysport are generally considered safe and have been approved by the Food and Drug Administration, or FDA, since 2002 and 2015, respectively. Most Botox injections are delivered in the face to train key muscles not to work so strongly. One of the most popular sites is the Angry 11s, located between the eyebrows. The forehead is also a popular Botox injection site. Both of these areas can make a person look worried, angry, and older than they are. Furrowing the brow can be caused by stress, worry, or squinting due to poor eyesight or sun exposure. Over time, this furrowing can cause lines and wrinkles. Botox injections stops muscles from forming this expression temporarily. Regular injections can atrophy these muscles, making them weaker and unable to furrow as deeply or regularly. This is one instance when atrophied muscles are a good thing. The more regularly Botox or Dysport is used, the less a patient may need it long term. Why Botox? The Angry 11s or glabellar lines are by far the most in-demand site for Botox injections. However, many patients also request injections near the eyes to treat crow's feet and around the mouth to lessen the appearance of the marionette face. Botox and Dysport paralysis is temporary. Most patients report that it lasts between 3 to 6 months. Regular re-injections will be necessary to maintain aesthetic appeal and to teach the muscles to be weaker. Botox and Dysport are incredibly effective and delivered in units. Only your dermatologist can determine the best number of units for you and your skincare goals. Botox and Dysport treatments should only be performed by a physician or a trained nurse injector. The administration of Botox Dysport pre-injection recommendations. During your Botox or Dysport consultation, you will be provided with a list of pre-injection best practices. These include avoiding alcohol and caffeine at least 12 hours prior to treatment. Patients should also avoid certain medications 12 hours pre-treatment, including anti-inflammatory medicines such as aspirin. Bear in mind that Botox and Dysport don't take effect immediately. It is a good idea to schedule injections at least 2 weeks before any special occasion to allow for proper healing and maximum effect. Side effects are rare and minimal, but can occur and you do not want them to interfere with your events. Why Botox works. Both Botox and Dysport inhibit muscle movement. However, skilled injections will not interfere with natural expressions. Dynamic movement is maintained while muscles that cause undesired effects, such as those used during anger or worry, are repressed. A vast improvement in appearance is visible within 1 week. What to expect after Botox? Some patients report a mild discomfort, which is common after any injection. Slight swelling or bruising may occur, but is rare and does not last for long periods. Patients can return to work and other daily activities that do not lead to sweating immediately after Botox or Dysport injections. Post-injection instructions. Every patient is given post-injection instructions to take home. This includes the option to treat discomfort with Tylenol. Most other types of pain medication are not recommended due to anti-inflammatory properties. Do not touch the area, lay down, or sweat for at least 4 hours post-treatment. How long does Botox last? How long Botox or Dysport lasts depends on the patient, the severity of muscle strength, post-treatment care, the skill of the injector, and the number of units used. On average, Botox and Dysport last between 3 and 6 months. The effects of the injections will fade naturally. Maintenance injections are necessary to maintain the desired effect and to train muscles to become weaker over time. It is possible that routine maintenance injections may lead to muscle weakness, which can result in fewer necessary units or results that last longer. What is the downtime? There is no requisite downtime beyond avoiding touching the area, laying down, or sweating for 4 hours after treatment. It is common for many patients to schedule Botox or Dysport injections as a lunch hour treatment so they can return immediately to work. Are you a candidate for Botox or Dysport? Candidates for Dysport and Botox injections are at least 18 years old, want to improve facial appearance, struggle with unwanted lines and wrinkles, desire to look younger, happier, healthier, and well-rested. Other applications for Botox injections. The face is the most common area for Botox injections, but Botox can also be used to treat excessive sweating. Botox injections in the armpits, soles of the feet, and palms of the hands can effectively inhibit sweat glands. Excessive sweating can be embarrassing and frustrating. Botox injections block the chemical that stimulates sweat glands, and just one treatment can mean months of relief. Most patients receive maintenance injections every 6 months. Botox and Dysport are two of the most well-known, popular, and effective anti-aging treatments. These neuromodulators are a type of injectable prescription medication that temporarily freezes small targeted muscles. Both Botox and Dysport are generally considered safe and have been approved by the Food and Drug Administration, FDA, since 2002 and 2015, respectively. Most Botox injections are delivered in the face to train key muscles not to work so strongly. One of the most popular sites is the Angry 11s, located between the eyebrows. The forehead is also a popular Botox injection site. Both of these areas can make a person look worried, angry, and older than they are. Furrowing the brow can be caused by stress, worry, or squinting due to poor eyesight or sun exposure. Over time, this furrowing can cause lines and wrinkles. Botox injections stops muscles from forming this expression temporarily. Regular injections can atrophy these muscles, making them weaker and unable to furrow as deeply or regularly. This is one instance when atrophied muscles are a good thing. The more regularly Botox or Dysport is used, the less a patient may need it long term. Why Botox? The Angry 11s or glabellar lines are by far the most in-demand site for Botox injections. However, many patients also request injections near the eyes to treat crow's feet and around the mouth to lessen the appearance of the marionette face. Botox and Dysport paralysis is temporary. Most patients report that it lasts between 3 to 6 months. Regular re-injections will be necessary to maintain aesthetic appeal and to teach the muscles to be weaker. Botox and Dysport are incredibly effective and delivered in units. Only your dermatologist can determine the best number of units for you and your skincare goals.